Thank you very much, Selma. Thank you all. Mambo VP Kenya. Mambo VP. Good afternoon, everyone. My name is Kangwa Kasonde from the USA Checkup 2 activity in Zambia, being implemented by John Snow Health. I'm the District Coordinator Dreams Programming. Okay, so adolescent girls and young women in Zambia face a number of intersecting traumatic challenges, ranging from child neglect, orphanhood, coming from broken homes, teen pregnancy, poverty, and sexual gender-based violence, to name but a few. Trauma can profoundly affect mental health. Adolescents experiencing depression and anxiety may rely on maladaptive coping strategies, such as substance use, which can further impair their judgment and lead to risky sexual behavior, increasing their risk of HIV acquisition. Kapiri, Mposhi, where I'm coming from, is a transit district linking the route to Congo DRC and Tanzania, with high rates of transactional sex involving international truck drivers, which exacerbates these risks. So sadly, I must make mention to say, older female sex workers in Kapiri, Mposhi, who feel they can't do that anymore, start initiating their nieces or their children to continue with the work, and then they get the money, okay? So AGYW in Zambia have a higher risk of contracting HIV compared to other population groups. Now, if any other AGYW is at high risk, what about an AGYW who's initiated into sex work? Okay? HIV prevalence among AGYW remains a national concern, with about 9.1% of AGYW aged 15 to 24 living with HIV. The USA Checker 2 activity under the DREAMS initiative utilized trained peer safe space mentors to engage adolescent female sex workers. Peer mentors are leveraging on their lived experiences to pass on information to their peers. That way, this information becomes information, and what they've gone through, their experiences, becomes relatable, which can improve program acceptance, program ownership, and sustainability. All program staff on DREAMS and USA Checkup 2 and volunteers, they've been trained on GBV lives and the community mental health counseling training. My colleague Lisa mentioned about how Checkup 2 has incorporated mental health in already existing health services that we are providing. A standardized evidence-based curriculum was used in safe spaces to provide HIV prevention messaging and skill building tailored to each adolescent's unique needs after risk profiling. The adolescents were met in safe spaces of their choice, ensuring a secure environment where their challenges could be addressed and their needs could be met. Between April 2024 to June 2024, the DREAMS team in Kapiri, Mposhi district reached 31 adolescent female sex workers in their safe space with individualized packages of services. Of the 31, 25 tested for HIV, 20 accessed PrEP, 17 accessed family planning services, 21 were screened for STIs, 25 accessed condoms, 31 accessed tailoring skills building trainings, and joined in savings groups. So those are just pictures of the activities that the girls were involved in. There's a photo of girls doing the deep breathing exercise during the mental health group therapy session. We have girls in the middle showcasing the different outfits that they make under the DREAMS initiative. And I must make mention, the outfits that I usually wear in conferences are made, including this one, are made by the DREAMS girls back home. Yeah. And then on the far right is a vibrant team of my team members back in Kapiri, Mposhi, which includes the teen mentors, the teen connectors, the mentors in safe spaces who are doing the most. These are the foot soldiers without whom I wouldn't be standing here presenting this abstract today. And then we also have a session, a causal tailoring skills building session, where a girl who's a peer instructor is passing on the skills to her peers. And then we have our youthful clinician there providing a service, family planning to an AGYW. So this intervention highlights the need to address social and structural determinants of health that drive high-risk rates among adolescent female sex workers. If we are going to address these social and structural determinants, we are going to sustain the current gains that we have so far. Empowering these adolescents through education, sexual and reproductive health services, economic empowerment, skills building, psychosocial support, and harm reduction strategies is key to reducing their vulnerability to HIV. Innovative and targeted interventions are recommended to meet the specific needs and challenges of adolescent female sex workers more effectively. In closing, I'll leave you with this. The success of these interventions hinges on the collective efforts of project teams and the communities that we serve. And most of all, and most importantly, co-creation with young people. Nothing for them without them. This will enable us to have data-driven programming, meeting the unique needs of young people. Thank you very much.